As iKure is growing, we are at a crossroads. Our objective is that how we would be able to bring in academia, MedTech integrators, platform builders, and iKure as executors under one platform. Over our journey, we have many thought leaders, strategic advisors, partners, clients who have supported us. And now it was time that as iKure is building this global collaborative platform to bring in our journey to help us strengthen our model, strengthen our systems as we scale. So that is how the objective has been to conduct this international workshop in Kolkata. Over the 2 days, we discussed on 6 important themes. Theme 1, in case of NCD management, we discussed that how we can move from reactive care to continuum of care that can be supported through community-led prevention. In theme 2, we discussed on health insurance, that how health insurance can support the entire patient's journey from primary to secondary and then tertiary care. In theme 3, we discussed on blended and catalytic financing innovation models, that how it can truly support the future of healthcare systems. In theme 4, we discussed on MedTech, that how we can truly move from pilots to scalable models. In theme 5, we discussed on supply chain models, that how we can ensure last mile care continuously. And in theme 6, the data governance centered around the very importance of trust, that how we can design and create models that is secure, interoperable, that can help in making better decisions. At the end of the 2 days, all these discussions, they converge at one point, that how we can move from decisions to real actions on the ground. So that was the different optics which our partners, stakeholders, they really appreciated, that this platform can really work as the living lab in a way wherein we can brainstorm our ideas, we can brainstorm our thoughts and takeaways, we would be able to execute that on the ground. That has been the core objective of this workshop, and I really feel very, very deeply humbled that our stakeholders, they have taken enormous efforts to come all the way to Kolkata from across almost more than 8 to 9 countries.